All right, good morning, Dr. Griffith. I'm Tashira. I'm one of the nurse practitioner students with Albany State, and I'm here to conduct a musculoskeletal exam on you, okay? Do you consent to my video?
Yes.
Perfect. All right, first I'll start with assessing, hold your head up straight for me. Assessing the neck and shoulder area. His neck is midline, it's erect, the head is symmetrical and round. Neck and head is midline to the shoulders. The shoulders are symmetric. I'll palpate now the trapezes and the sternomastoid muscle, and they're intact and symmetrical as well. So I'm gonna move on now. I'm gonna ask you to do a couple movements for me. First, we're gonna start with abducting your shoulder. If you would take this arm and just raise it to your side for me. Perfect. And do the opposite arm now. Great. And you can rest your arms. Now we're going to do external rotation of the shoulder. And I'm going to ask you to take your arm and touch your back. Pat yourself on the back. All right, great. And I'll do that motion for you also. All right. And then do that with the opposite arm for me. Okay. I'm going to do that motion for you also. All right. And now we're going to do adduction. I need you to take your left arm and just reach it across your body. Perfect. And don't let me move it. Okay. Let's do that with the opposite arm. Same motion. All right. Perfect. Relax. So now I need you to take this arm and reach behind your back and touch your scapula. That's great. Relax this one. Do the opposite arm. All right, great. All right, now we're gonna do some neck motions. I need you to flex your neck, which is chin to chest. Okay, and relax. Chin up to the air. That is extension. Great. Now let's do some lateral movements, which is ear to shoulder. Great. Let's do the opposite side. All right, and all right, let's do your chin to your shoulder. Just turn to the side. Great. All right, so he has full motion in his neck, and I'm gonna need you to do your ear to your shoulder to the right side, and don't let me move your head. Okay. Okay. Let's do the opposite side. All right. Perfect. So the strength is good there. Reach out your arms for me. So now I'm gonna just inspect the hands for any swelling, nodules, or deformity, and there is none, no tenderness. So I need you to take your wrist and drop it like that. All right, and bend back. Great. All right, and now I need you to drop it again and don't let me move it. Okay, good. So now I'm gonna do your fingers. We're gonna abduct the fingers, which is spread them out, and adduct. Great. All right, and that's good. We're gonna do the same thing with this one. Wrist down, flexion, extension up. All right, abduct your fingers and adduct. All right, and do your wrist, drop your wrist. Don't let me move it. Great. Now I need you to internally rotate the wrist, which is that. Okay. All right, great. Let's do this side. Internally rotate. Great. Palms up, down. All right, perfect. All right, now I need to pause this so we can move. All right. So with your elbows, I am going to feel here. There's no nodules, no swelling, no tenderness, no deformity noted there, and none in the opposite as well. So now I need you to take your left elbow and flex it for me. Perfect. Extend it. Great. Let's do the opposite elbow. Flex, extend. Perfect. Now I'm gonna have you lay down on the floor. All right, so now I am going to assess the hips. His hips are midline. One is not higher than the other, and they're symmetrical in shape. The muscle and the glute muscles are tight and symmetrical as well. Now we're gonna start with internal rotation of the hip, and that is, let's bend your knee here. All right, and internal rotation, perfect. And then we're gonna do external rotation. Let's take your ankle, put it here. That's external, and I'm gonna put pressure on your leg and don't let me move it, okay? All right, great. Now we're gonna do flexion all the way up for me, perfect. All right, and I'm gonna put pressure, opposite pressure, don't let me move your leg, all right? Now we're gonna go ahead and flex the knee, great, and extend the leg back. We're gonna also do the opposite side here. So internal rotation, in, and once again, don't let me push your leg down, great. External rotation, bend down for me, that's external, don't let me push it down, great. The strength in both legs are strong and equal. Now we're gonna flex your leg up. We're gonna go ahead and do the knee extension or flexion. All right, perfect, and down. All right, now we're gonna do abduction of the left hip. Let's take this leg out, great, back in. Let's do the opposite, back in. All right, and that concludes our hip assessment. We're gonna move on to spinal. All right, once again, the shoulders are symmetrical. The neck is midline to the shoulders. The thoracic spine is concave and convex here at the cervical area. Now I'm gonna have you do some movements. Have you lean forward for me, bend over and touch your toes. And again, the spine is straight. There's no curvature, deformities noted. Stand up straight for me and bend back. All right, good. Now I'm gonna have you do lateral movement to your right, bend over to the right. All right, and do the left. Okay, and we're gonna do some twists. So turn, perfect. All right, and there's no pain or anything with movement. All right, I'm gonna have you have a seat for me. Sit there. One last thing. With the feet, the ankle assessment. So I'm gonna have you flex your ankle up. That's dorsiflex. Plantar flex is down. All right, and don't let me flex up. Don't let me move your foot down. All right, good. Let's do the opposite side. Dorsiflex is up. Plantar flex is down. All right, and again, don't let me move your foot down. Perfect. All right, thank you. And that concludes our video.